Hello, good morning and welcome to NewsX. We're live on DSTV channel 421, GoTV channel 125 across all our social media handles. We're Joy News on TV. Coming up within the next 60 minutes, United States Agency for International Development suspends its supply chain of essential health commodities in Ghana's 3 northern regions. We'll look at the impact of that on the economy shortly. Also, Speaker of Parliament leaves 2-week suspension of 4 MPs after minority and majority leaders appealed for mercy.
So I have lifted the suspension order, and I do so instantly.
We have more as the committee set to investigate the chaos in Parliament has already commenced work. Also coming up, ECOWAS working to augment trade and commerce among member states. We'll tell you how it's seeking to do that. We have these plus business updates on our decks this morning. My name is Faustina Asaf. It's a good time to take a seat and please be my guest. Thanks for choosing us. We are your home of independent, fearless, and credible journalism. Now we start with the United States Agency for International Development because they have suspended their supply of essential health commodities in Ghana, with the regions up north being the most affected. Now the decision follows an executive order by the U.S. President Donald Trump enforcing a global freeze on U.S. foreign aid. Now this has also raised significant concerns about the availability of essential medicines and health commodities, particularly in the northern region, the northeast region, and Savannah regions, which rely heavily on the northern regional medical stores for distribution. Now, so how does this actually affect Ghana? We're looking at how Ghana benefits from the U.S. aid. Well, join me in the studio is data analyst Isaac Kofi, a key member of our research desk here at Joy News. Kofi, walk us through the details.
Well, firstly, U.S. aid is big. And why is it big? Because if you look at it on the African continent perspective, since 2017, the U.S. aid that has flown into the continent has always been above $8.3 billion. So that tells you that this is a revenue source, or this is a support scheme that is really important to Africa. Now, just this morning, we're trying to get additional information and put this conversation into proper perspective, trying to assess information from the USAID website. And what we realized was that the website was down. And we know not just the website, but other institutions and other offices that are actually put together for facilitating this aid are also not really working like the way they used to work a year ago, 2 years ago. Now, let's bring it home. Now, if you look at it on Ghana's perspective, what we gain from U.S. aid on average is usually around $150 million every year. Now, this goes into supporting education, health. There's also economic growth, agriculture, and governance. And so it's not just health, but this $150 million average inflows cut across 5 key areas that we actually gain the support to help. Now, because the conversations around health, we will break this $150 million down and look at the figure that we requested for this year. We were assuming that, U.S. aid will be available in 2025, so we placed the request for somewhere, let's say roughly $140 million, or let's say $138 million for this year. What we are understanding is that this aid has been cut. It means that this projection that we are looking for, we may not be able to get it. And when U.S. aid comes in, it comes in Forex. It means that it doesn't just go into, health or education, but also helps in, making sure that our CD is stabilized. Now, this 137.7 million Ghana cedis that we're looking for this year, let's break it down and see which sectors we're looking for this money to support. If you look at health, is the biggest component. Somewhere $69.2 million dollars is what we are looking for to support health infrastructure, health security, maternal health care, and other important areas under health care. $69.2 million Ghana says.
Well, I see why it's now a big deal for Ghana, because that's a lot of money. How do we bridge that gap? And that's a question we should be posing to the Ministry of Health. How they plan to bridge this gap?
Now, the interesting thing is that if you look at the budgetary allocation for all the, let's say now 23 or hitherto 30 ministries, if you take away the education ministry that usually will have the biggest budget, health ministry is next. And even if you look at health ministry's budget, most often the main component goes into compensation of employees, but the key support comes from aids and grants. That tells you that the entire health system of Ghana, especially when you look at it from infrastructure, security, another key aspect, hinges on aid, and the USAID plays an important role.
And it raises the question, really, Kofi, what happened to our Ghana Beyond Age agenda that we were
that's
pushing,
a good question.
You know, and looking at this gap, let's look at other sectors.
I mean,
how much is
this is health. I mean, this is what we're expecting this year. But let's even put the conversation in proper context, looking at it from the HIV/AIDS support. I mean, what we've been getting from the USAID. We know that since 2017, there's a package that was put together to support, the treatments of HIV/AIDS in Ghana, and we know that since 2017, the monies that have flown into the country as a result of this package or this system is around $140 million. It means that is also a key component that will be affected under the healthcare and other things. For me, the most important one is the maternal health, because that is a critical area under our health system. $69.2 million, and you will know that a key or a significant component will go into support for maternal health. Now we come to education, the sector with the biggest budgets in whenever we plan for the country, and 15.9 or roughly around $16 million is what we're expecting from the USAID in 2025 this year to support education. If you look at agriculture, very important sector, $33 million. And the last one has to do with climate, $3 million. And so if you add all of this, this is the 137 or roughly $138 million that we're looking for from the USAID this year to help key components or sectors of the economy. It's unfortunate that this support has been cut. It's not just Ghana that is suffering. When you go to Nigeria, they are also complaining. They were expecting $500 million. And so if you compare that to Ghana, you will see that, I mean, if we are complaining about, let's say, 140 million, how much more, Nigeria and Co. and South Africa who all, benefits from the USA. So
it appears we fail to walk the talk when it comes to Ghana Beyond Aid agenda. Well, in the northern region, they're already feeling the impact, and the Ghana Health Service Directorate there has already written to the regional body. They want help, and that statement is coming up on your screen shortly, just painting a picture of what they're going through as a result of the suspension. Now, they go on to say that the suspension directly impacts the following key areas. Last mile distribution. They go on to explain that the halt in distribution of services poses a severe risk of stockouts for essential medicines, vaccines, and other critical health commodities, potentially disrupting healthcare service delivery in the 3 regions of the north. They go on to say procurement and supply chain management support. Now, they explain that the withdrawal of technical assistance and logistics coordination provided through the Chemonics will weaken inventory management, tracking, and reporting systems, making it more difficult to ensure continuous supply. They go on to say several health programs reliant on USAID-funded commodities include maternal and child health, malaria prevention and treatment, family planning, HIV/AIDS services are likely to experience shortages affecting service delivery and patient care outcomes. So it's quite a broad issue we're looking at here. Now, in response to this urgent situation, the regional health management, the team convened an emergency meeting with the district health management teams and budget management center heads to assess the impact and explore mitigation strategies. And that's key. How best do we mitigate the impact? Now, after extensive deliberation, it was agreed that the interim Skynet Express, which was previously engaged by USAID for LMD, could serve as a stopgap measure to maintain scheduled distribution for the year 2025, while long-term solutions are explored. Well, let's go on Zoom now and speak to some of my guests. Join the conversation. I have Dr. Ishmael Lovo. He's an international relations analyst. Thank you so much for your time. I also have Professor Patrick Esumin. He is an economist at the University of Ghana Business School. Thank you so much for your time. I also have Alhaji Muhammad Awal. He's executive director for NORZAC. They run an NGO in the northern region. Thank you so much, gentlemen, for your time. It appears to be an all-male affair. But I'll start with Ishmael. Let's look at the international implication. The U.S. government's decision to freeze foreign aid, including the suspension of this aid, especially following that executive order by the President Trump. I'm wondering, how does this decision fit into the U.S.-Ghana relations? And could it signal a shift in American foreign policy towards Ghana and West Africa in general?
Good morning to you, and good morning to my co-panelists and to your viewers.
Good morning.
In fact, the coming of Trump into office already signals a shift in U.S. policy across the globe. Trump is a hardcore realist, and he wants to restructure the U.S. aid agency in line with American political interests. So obviously, as Africans, we should expect that the normal U.S.-Ghana relation will have some restructuring, and the freeze on aid is one aspect of what Trump intends to do, to make aid more of a political instrument rather than humanitarian. So his interest is to ensure that foreign aid become more aligned to American national interests, more importantly, political interests. But that does not mean that Ghana-U.S. relation will be strained. What it means is that Ghana must be more ready to take up more responsibility for looking after its own population, economically, health-wise, education-wise. We cannot continue to beg around the world, depending on others to take care of us. Trump is for Americans, and his interest is to ensure that whatever America is giving out is in the political interest of America. So yes, Ghana-U.S. relation will still be strong. It's about, after the 3-month suspension, it's about we making cases that what USAID is funding in Ghana is actually in line with American political interests. And of course, given the region we are, we can actually engage and make the case that continuous U.S. aid to Ghana is actually in their own interest. So it's all about restructuring our American government. It's all about positioning foreign policy to be in line with what Prof believes is the American first policy. So, and geopolitically, of course, it's not so good for the U.S. if it comes to soft power, because with U.S. aid, you are able to engage countries that the U.S. will not engage politically. But now aligning it with the State Department means that some of those arrangements will no longer hold for America. So yes, it will have a negative effect on American soft power across the globe. And of course, countries like Ghana may have to look elsewhere for help. But more important, they have to begin to look within to be self-sufficient in some of the things that we do.
We've just been doing a breakdown of some of the impact of this, especially on our key sectors, looking at health especially, because Ghana was expecting some over $60 million from the U.S. aid. I'm wondering, are there diplomatic channels Ghana can explore to negotiate an exemption when it comes to essential health services so that the impact in that sector is reduced?
Of course, it's when you reach out to them and you're able to convince them that these funding are so critical to Ghana and also to their interest. Because when you look at Trump and his foreign policy position, it's about America first. So if the thing doesn't appear to be in the interest of America, it is difficult for you to negotiate. So it's about putting up the case that, in fact, vaccine programs, fighting climate change is actually in the interest of America. Of course, it is in the interest of America to ensure that issues like climate change are dealt with, so that climate-induced migration does not end up in the shores of America. So you can actually engage them and try to explore that, well, this funding for critical sectors in Ghana is in the American interest and also in the Ghanaian interest. We must also leverage on the relationship we have with them. Of course, they have a base here in Ghana. Some of those things can be used as a, because Trump is a deal, like doing deals. So you have to use what you have to have a deal with the American people from now on. So yes, we can engage them diplomatically and see how they can exempt us from some of the freezes. But of course, the initial freeze is for a 3-month period where they intend to review all the programs that this agency has been running. You understand Trump from the perspective that there are some programs that were sponsored that do not actually have any humanitarian benefit. And from his perspective, being an anti-LGBTQ plus person, money is going to those things. He considered them as waste. So yes, you can engage them and try to find a way to get exceptions. But I believe that the ultimate is that over the long time period, you have to build your own self-sufficiency in some of these critical areas. You can't rely on foreigners to look after your sick people up north. You can't rely on foreigners to feed your people. You can't rely on foreigners to improve your security situation. You can't rely on foreigners to fight climate change for you. It is our doing. It is our business to look after ourselves. We are crying because we have not prepared for it, and somehow we have to find the money somewhere to cover for the loss that we've been seeing in these 3 months. So yes, we can engage them diplomatically, but the long term is that you have to be able to be self-sufficient in some of the things you do. Yes, currently you have the Chinese, the Russians, the EU who want to scale up to ensure that countries like Ghana do not unnecessarily come under strain. But those will be short-term things that you want to do. Over the long haul, we must be able to manage ourselves more prudently, economically, so that some of these things do not hit us hard. The Sahel states that have virtually cut ties with the US and others. This news will not affect them, although of course some of them, like Niger, still receive significant US humanitarian support. But they have turned that path where they have won themselves somehow of some of these states. So I'm not sure that there's so much panic in Burkina Faso. There will not be so much panic in Mali. But there's so much panic in Ghana because we have structured a system that is so dependent on aid. After years of saying that we are going beyond aid, we have not put in the structures that will win us off aid. So aid will continue to be a signal part of what we do here. So yes, engage diplomatically, try to see if you can get some relief using your relationship with them, including the presence of their military here and so forth and so on, and then making the case for them. Then we may get some relief, but long haul, build your own self-sufficiency.
I recall the previous president was quite passionate about moving Ghana beyond aid, but it appears we dropped the ball, and this is the effect. Now, what other international body can we lean towards to gain partnership or some of this aid in the interim, whilst we look at putting together the structures that you're making mention of?
So in the interim, you can appeal to the UN for more support. Of course, the UN itself is taking a hit because of the cut from Trump, because he has already indicated that he's leaving the world.
How about China? Should we look at China?
I'm building a case. So okay. You may also look at the EU, EU, the British, who may want to scale up their own aid in order to push in democracies in the region, leveraging on the fact that you are still a very stable democracy in a region that is flat with coups. You may also look at the Chinese and try to see how they can help you in the short term. But of course, you must also take note that they also have their own interests when they are coming in. I always believe that the solution to win ourselves from Western support should not be Easternization. It will result in the same thing. So in the short term, yes, you may appeal to the Chinese for some aid to help you solve your problem. But of course, they will come in with, if you have resources to give, I'm sure China is willing to give you abundance. Of course, that's the model they are promoted across the continent. But this is a humanitarian situation. You want to appeal to them. You want to appeal to the Russians. But you realize that the Russians are not so much into some of these humanitarian things. They are more of into security and other things. They are dealing across the South region. So the UN, EU, the Chinese, of course, are the likely places that you may go looking for aid. Or internally, you may want to look at some sources of funding that can help you pushing it yourself while you look for the international solution.
Now, we know that this suspension is for a 90-day period. Should it be extended further? What would be the impact on us, and what can we do in the interim to fix that gap?
Now, so if it's extended further, that will mean that you are going to lose about $150 million, which normally annually comes to you through USAID. If it's extended further, it means that you have to find the money to be able to keep the health services, to keep the educational sector, all the things that they were doing. You have to keep them going. So what you should be doing now, I think that the most sustainable path is to look at how we can actually look for internal sources of funding in order to cushion ourselves to a level before appealing to bodies like the UN, like the EU, to increase their own assistance to us. So yes, if it goes on for long, which I'm not sure will go on for long, because they will review and they will look at countries that they think they have geopolitical interest, countries that they think is aligned to the US foreign policy. They will cut off, even if they will resume, they will cut off some of the spending. There will be reduction in areas like climate change. There will be reduction on issues such as LGBTQ+, and those things that they consider not to be in the interest of America. So even if it resumes, you'll be expecting some reduction in funding. So you must look for the money. If you think that the things they do are so crucial to your development, we have to find a way. We were expecting e-levy to go. We were expecting other taxes to go. Perhaps you could look at some of those taxes and go back to the people and renegotiate your campaign promises and see if they will agree with you to actually attach them to some of these new problems that you are facing. But of course, as I said, you have to find the money here to be able to address the shortfall, even if it's extended.
Thank you, Doc. Let me bring in Professor Patrick Isuman. He's an economist at the University of Ghana Business School. Thank you so much for your time. Now, we've been hearing from Doc and the potential impact. We've also been learning about how significant the USAID's financial contribution is to Ghana's economy. What's the economic impact this suspension will likely have on our economy?
Well, good morning, and good morning to viewers and also to my fellow panelists. Thanks for having me. I think my friend Kofi already identified some of the impact. I think 150 million on average a year is quite a substantial amount. If you look at how much we even get from the IMF program, you know, after every approval, after every review, we get about 360 million. So that amount is significant. And he's also spoke about the fact that part of that supports the cities. I mean, 150 million of regular inflow annually is something that's substantial. But I think one aspect is that, yes, part of it goes to health, education, but there's the USAID also engage in a lot of business support services. And those actually help to boost the viability of our businesses in terms of, and that has long-standing implications for growth going forward. So I think when you begin to quantify all of this, is beyond the 150 million that you see. There are other multiplier effects that will tell us that the main impact is beyond that. Now, in terms of the health, also keeping people healthy, generate productivity effect. So it's not just the 150 million, but there are potential other angles to look at how significant this is. I think the other thing to understand about the impact is the suddenness. You know, even though, you know, the moment Mr. Trump was elected, there was a sense that, you know, many people were holding their breath, wondering exactly what's coming up. I don't think many people expected that we wake up one morning and there will be such immediate disruption to such a critical element that many countries depend on. So I think in terms of the impact, is even if after 3 months everything is restored, you know, there are people who depend on some of these for their daily life. And the livelihood impact is something that will not be restored. So I think the economic impact, as well as the social and other related impact, is quite substantial.
We've been hearing from Dr. Ishmael propose that we need to find the money. But looking at our economy right now, we're already under an IMF program. Can we really find the money?
Well, I think the short answer is probably no. But I think, is the money there for us to find? Yes. Is the money there in this country for us to find? Yes. We just have to put our money where our mouth is, or our mouth where our money is, whatever. I think, now, and I like it when Ishmael made that point about the fact that over the long term, you cannot continue to depend on other countries for essential things. We missed an important this lesson when the COVID came around and the COVID vaccine started coming. And we should have learned from that when it comes to the crunch, you can't rely on any country for critical supplies. We just, as we like to do in this country, we just, lamented for a couple of years and then we just moved on with our lives. And then even though we said we were going to do Ghana without aid, we clearly know that we didn't really put a specific plan in place to make sure that happens. But now that this has come, I think ultimately, if we think that the health of Ghanaians are as important as it is, and the agriculture and the education, if we feel that it's as important as it is, then clearly we have to reprioritize. The difficulty we have immediately is that we've had a change of government. The new government is trying to put a team together. It hasn't even had a plan to put a budget together. And it will be a couple of months or so, at least it will be towards the end of next month before a budget will be put together for us to begin to, reorganize our plans and try and then deal with it. So this has come at a really difficult time. And I think in terms of immediately mobilizing money, I'm not sure. But I think whatever diplomacy we can play to ensure that at least some of the critical things are restored at the earliest opportunity, while we begin to look at medium-term and long-term ways of addressing this, is something that should be our priority.
As we wrap up the conversation, some of the lessons we're drawing from this crisis is the need to reduce over-dependency on foreign funding. But can we really do that as a country? Can Africa really be free of international aid?
Well, if we think that we cannot be free, can we? I mean, how much does it cost taking hard decisions so that over the long term we can be on our own feet compared with always being at the beck and call of others? Like what you are going through, you sleep one day and you wake up and suddenly somebody says, I'm not giving you what I'm usually giving you. I think it's not a question of whether we can do. It is something that we have to do. You can't run a country like this where, financing of critical things are dependent on other countries. And it's not like we don't have the means. We have the resources. I think every time the two main parties, every time they are in opposition, they're able to identify all the critical resources that are there to be mobilized. We know the amount of illicit financial flows out of this country is quite unbelievable. The amount of money that we give to profitable foreign multinationals in the name of attracting FDI, in the name of doing something, they are all there. The funds are there. It's just whether the powers that be will have the political will and the commitment to ensure that we put our money where our mouth is and say health is important to us. I think I think the way we take health in this country is quite unfortunate. I don't know if when people get to the stage where they are at a critical stage and they have to interact with our health system, I think that's where we really begin to see the problems that are embedded in the system. And I think we really have to take action. So it's not a matter of whether we find the money. We have to find the money. And we can't find the money. If we feel that health, and then indeed all the other things that will be impacted by this announcement are that important to us.
Oh, thank you so much, Professor Patrick Asuman. He's an economist. Let me bring in Alhaji Mohammed Awal. He's Executive Director for NORSAC. They run an NGO in northern Ghana. So I want to bring the conversation home and look at the exact impact. How has this suspension affected healthcare delivery in that region?
Thank you very much, and good morning to you and my colleagues, panelists. I also greet your viewers and listeners. I think we have a situation at hand to deal with. And I'm happy Prof and Ishmael have given the context at bigger level. But let me add that the 137 million we are talking about is actually focusing on support, direct support to government. In fact, USAID support to Ghana is at 3 different levels. We have what we call the G2G. Then we have what normally is referred to as grants and cooperative agreement with INGOs and civil society organizations. And of course, the last one looking at contribution to multilateral support. So the G2G is what we have focused on and talking about 137 million thereabout. If you look at the support that is coming to civil society organizations and international NGOs, the situation is even worse. We are looking at about 11 existing programs that are taking place in Ghana, recently awarded by USAID. You can talk about the accelerating social and behavior change, which is looking at 7 key components, talking about maternal and neonatal child health, family planning, nutrition, maternal and neonatal child health, malaria, and emerging epidemics. These are 7 key areas that accelerating social and behavior change is focusing on. And we have a budget of around $40 million US, again in the northern sector. We have advancing nutrition that is also going on. So these are all major projects. The 3 health projects alone are close to about $90 million US. And these areas support Ghana Health Service from system strengthening at national to community level. At community level, in fact, even at regional level, it's difficult for Ghana Health Service to hold quarterly and annual performance reviews. They get support from USAID to conduct these reviews. And the reviews allow Ghana Health Service to know areas where they are doing well and areas that need strengthening. To the extent that Ghana Health Service rely so much on USAID funding and other donors to hold these reviews, tells you that we have a lot of challenges that we have to deal with. So if you look at even community level, what we call the community health action plans, development and reviews, you have the accelerated social and behavior change, and then Q4H, that is quality for health, which is being implemented by, I think, GSI. They all focus on community level system strengthening.
So the issue is bigger than we can even imagine. Now let's look at interim solutions before the health facilities and individuals begin to feel the pinch of this suspension. What do you propose can be done instantly to fix the problem?
Yes, I think if you look at what is happening even in the Western region alone, Western region we had about 30 people dying out of cholera. Upper West region, we're talking about CSM. There's a need for campaign to mobilize citizens to behave well, to conduct themselves in ways that will help us reduce these unnecessary deaths. We will not have the resources. Like Ishmael said, government has to come in and take leadership. We need resources that would allow Ghana Health Service to have uninterrupted supplies. Vaccinations must continue. And so we need to engage UNICEF, we need to engage the EU, and we need to engage even World Bank to come in. Because at the moment, I can tell you that government is cashed out.
Thank you so much.
I agree with some colleagues that we can find the money, but I must admit that it will be challenging for government to fill this gap at the moment. We will have to engage other donors to ensure that we have uninterrupted vaccination services going on. We still have our facilities providing services. Then we have Ghana Health Service continue their monitoring. They should come in and support those budget lines. That is what we need at the moment.
Thank you
And
so
I can
much,
tell you that
Mohammed. I know you're very passionate about this conversation, and it's a conversation that we'll be having in subsequent bulletins. So don't go anywhere. Here on the Joy News channel, we'll be engaging you further so that you can just prefer more solutions to the problem. But we have to move away from this at this point. Now, away from that, for decades, the Abidjan-Lagos corridor has been a vital route for trade and movement within West Africa. But checkpoints and other bureaucratic bottlenecks continue to hinder seamless regional integration. At a high-level technical workshop, corridor countries, including Ghana, unanimously called for urgent political intervention to eliminate these barriers to ensure a smooth facilitation of the Abidjan-Lagos corridor project. Well, join me now via Zoom for a conversation on this is Chris Appiah. He's Director of Transport at ECOWAS Commission. Thank you so much for your time here on Newsdesk. Now, the Abidjan-Lagos corridor, I know that it is a crucial trade route, yet persistent checkpoints and bureaucratic bottlenecks, it often hinders free trade movement. So I'm wondering, what are the key challenges that are still facing the corridor?
Thank you very much, and good morning.
Good morning.
Thank you for this opportunity to share some highlights on our heavily traveled corridor. So the major bottlenecks, as you indicated as part of your question, has got to do the cost of transport, which also translates to very high cost of trade in our region. In fact, unfortunately, the ECOWAS region has been reported, or it's in all the credible reporting sources, that we have one of the most expensive trade and transport costs when it comes to cross-border trade. This directly also impacts on the growth of our intra-regional trade, which currently stands between 12 and 15%, right? So we are not trading amongst ourselves as member states of ECOWAS properly, and that has enormous impact on suppressing the economic growth that as member states we seek. So also to put it in perspective, the Abidjan-Lagos corridor, to which Ghana has the longest section of the over 1,000-kilometer highway, Ghana has more than half, almost 544 kilometers. This corridor carries 75% of trade in the region, right? So it makes it a very, very important corridor. And for Ghana, it makes it a very, very strategic corridor through which we can improve and also benefit from regional trade, allowing the citizens of Ghana to trade freely with the countries on the corridor and in general with the region. So the impact is very, very dire, and it's high time we found solutions to them.
At the recent workshop, I know that corridor countries, they actually had a meeting and they're looking at some of the ways they can deal with this, and they also called for urgent political intervention. I'm wondering what specific commitments were made by the political actors.
So this workshop, convened by ECOWAS, was in the context of the Abidjan-Lagos Corridor Highway Development Project. As you may be aware, the heads of states of the 5 countries signed a corridor treaty to construct a seamless supranational highway from Abidjan to Lagos, which obviously comes through Accra and Ghana. Now, what this means is that the road will be lifted, figuratively, over the national laws of any of the 5 countries. They want the road to operate as one. That means there should be no borders eventually. There should be no roadblocks. And once you enter any section of the road, you get on a community network that should take you from beginning to end. So this is the context. Now, as part of the road development, we have a component that deals with trade facilitation, right? So we're not just constructing the road like a tunnel. We're using the road to also facilitate movement of goods and persons. And that's why trade facilitation comes in. So this workshop was to consider recommendations from ECOWAS to help us achieve this level of facilitation before the construction, that is from today till when we are constructing, and then afterwards when we have the highway. Now, when we went through the evidence, right, and the diagnostic report, which shows, because we are talking in the context of Ghana, let me give a little picture of the Ghana, which shows that Ghana, for instance, has one of the highest number of roadblocks when it comes to this corridor. So when you take from Accra to Aflao, at certain points, we were recording over 27 stops. And these stops comes in the way of customs stops to check for goods, police for so-called security reasons, and then we have local or district or township police who, check these GPRT drivers and driver licensing and all that. So combined, and sometimes even immigration, to check the documents of travelers and all that. So combined, these are posing major challenges on the Ghana section. When you compare to other corridors, side of the corridor, Togo, for instance, has only 2 checks. It is true that Togo has a very short section compared to Ghana. However, per kilometer, they are doing less than 1, right? If you go to Benin, there's only 1 checkpoint throughout their section. And they have the same challenges we have, so-called security. In fact, they are also bordering Niger, which is also in this situation of the coup d'etat country. So the context of Ghana is no good. Now, the recommendations made by the experts, when we went through the reports, we realized that at the technical level, 1, we have all the community text, which aligns with international best practices and aligns with the continental drive to facilitate trade. So the problem is not a lack of text.
Okay, so I have to come in at this point, even as we wrap up the conversation. You just made mention of how the different checks we have in the countries posing a threat to especially free trade. But then there's a bigger concern about security threats, especially because our borders are very porous. If we're taking out all these checkpoints, won't that expose Ghana to security threats?
Yeah, so I think there are some different objectives that we seek to achieve, right?
Okay.
From best practice, and we have neighboring countries, and that's why I mentioned Benin, who also borders Niger, Togo, who also borders Burkina Faso. So we are in the same context when it comes to security, let me put it like that. Now, the checks are conducted at the port of entry, that is at the border post. So our inability to conduct proper controls and efficient controls at the border shouldn't come to the detriment of trade. If we fail to identify and police our porous borders, it shouldn't come to the detriment of the movement of legitimate trade. So one of the key recommendations that came out from the experts, and it came from the evidence we had, that for the countries who are doing very well when it comes to facilitation, and I'll mention Benin in this case, there was a presidential directive that regardless of the seeming security threat or loss of revenue, as the customs officials will put it, I want my corridors to be free. Do your checks at the point of entry. And even that it shouldn't pose a challenge at the border, make it facilitated or quick.
Okay.
So